I'm Dr. Jonathan Weiler here at Weiler Plastic Surgery in Baton Rouge, and today we're going to talk about lip augmentation, or otherwise known as lip enhancement. So it's very common as both females and males age that you lose volume in your face. In other words, your face starts to deflate as you get older. The volume loss is due to loss of fat, loss of muscle, and also loss of bone in the face. So one of our most common procedures here at Weiler Plastic Surgery is lip enhancement or augmentation. So if you pay attention to your lips and look back at pictures of yourself in your late teens and your early 20s, you'll notice that your lips have changed in proportion and size. Often patients come in complaining that their lipstick no longer sort of can be applied like it used to, or they have some vertical lip lines that are bothering them and cakes on some lipstick in there. So what we like to use here at Weiler Plastic Surgery is hyaluronic acid fillers to restore the volume and rejuvenate the lips. Now when we talk about hyaluronic acids, there's a whole host of different brand names. We use lots of them, but today we're going to use something called Juvederm Ultra. We also use Restylane, we use Juvederm Ultra Plus. There's lots of different things. But what a hyaluronic acid is, it is a replacement for the naturally occurring substance and fat that you've lost in your lips. When you look at someone's lips, and we have a lovely patient here today, Heather, we're going to sort of evaluate her very quickly. But what happens is, as you age, you lose volume. You lose volume in your upper lip. You also lose volume in your lower lip. So we always talk about, when we talk about lip enhancement or augmentation, we always treat both the upper and the lower lip. It's almost a 1/3, 2/3 rule. Your lower lip should almost always be 2/3 of the distribution of your lip volume, and your upper lip should be 1/3. One thing we talk about with patients is definition is very important in the upper lip. It's not just volume or size. So what we like to accentuate is the Cupid's bow. The Cupid's bow is that sort of wave type appearance to the upper lip. It's the interface between the pink colored skin of the lip and the fleshy toned color of the upper lip. We also like to enhance the philtrum columns, which extend down from the lateral aspects of the nose. So we'll enhance the entire aspects of the vermilion border. This is the interface between the two different colors of skin. We'll enhance Cupid's bow. We're also going to enhance the philtral columns. This is going to give you a very delicate architecture and restore that delicate architecture back to the upper lip. We'll volume enhance the upper lip, and we'll volume enhance the lower lip. The process takes us about 20 to 25 minutes. We numb the lip for a good 20 to 25 minutes before with some topical numbing cream. This makes the procedure relatively painless. We do tell patients that you will swell for a day or two afterwards. So it's not swelling that's going to interfere with your daily activities, but if you have an event planned for the next night or two, which I don't think you do, this is a Monday, so hopefully she's taking it easy this week. But if you have an event planned, you want to be very cognizant of that because you will swell for that first 1 to 2 days. It looks very normal within 3 to 4 days. It's a quick procedure. It's an outpatient procedure. You literally walk in, you walk out, and total treatment time with the numbing time takes us about an hour. Today, one of our great PAs, Piper, is going to demonstrate the procedure for us and walk us through every step.
Hi, I'm Piper. I'm a physician assistant with Weiler Plastic Surgery. Today we're going to be treating Heather with some lip enhancement using some Juvederm Ultra to fill her lips. We've let her sit for about 20 minutes with some topical numbing cream over her lips. So we'll take that off. She should feel nice and numb. The product itself does have some numbing lidocaine in the medication, so as we go throughout the procedure, it will be a little bit more comfortable for her to have the procedure itself. Heather, if you'll pick the mirror up and show me where we want to concentrate on your lips. So do you want to kind of redefine some of your border and just add a little bit more volume through the whole lip?
Yeah, I think so. I'm just trusting Piper here.
Okay, all right, okay. So I'll go conservative for you because, you know, it's your first time. We can always save the syringe and kind of re-inject in a couple of months or so. If next week you love it and you say, let's do a little more, we can do that as well.
Okay.
So at this point, I want to clean the area before I do any injections so that everything is nice and clean. Great, so I'll start by lining your lips just a bit With each injection, I will pull back and aspirate to make sure that I'm in the correct area that I want to be. So just the lines of the lips so far. I'm going to start to fill just a little bit. Open up just a bit. You to kind of take a look, and if you want to save, I'm almost to a half of a syringe. Okay, you okay to go for a couple more injections? Okay, perfect. So take a look. So sometimes I've kind of filled in through here to give a little bit more of a pouty look through here. Every once in a while I have patients that like kind of a little bit more of a Victoria's Secret kind of a look. It's a sexy pout, but it's a little bit more lateral. Do you want me to bring it a little bit more lateral, or do you like a little bit more of a pout? What's your thought?
What do you think?
I think you can go with a little lateral, but if you feel like you want to kind of give it a break, then we can do that too. And we can always come back in a week or two or a month, a couple of months if you want to, and fill in.
Girl, you do what you think looks best.
Okay.
I mean, this is what you do.
Okay, all right.
Okay.
I want to do a little bit more on the lateral. Are you in for it there? Are you
In for
okay?
it. I'm in for it.
About your filtral columns, do you want me to leave them as is? Now you're a little swollen right now from the product, so you'll go down just a bit from here. You'll go swell just a little bit more, and you'll start to see some of the swelling go down in the next couple of days. Do you want me to redefine your filtral columns through here? You want to save it, and you can see we have 0.4 left, and we can kind of plan later. Okay, perfect. Let me clean you up for the camera so they can kind of get a better. So we just completed Heather's first treatment of Juvederm to her lips. We enhanced both the top and the bottom lip, and we added a little bit of definition to the borders of her lips as well. If you need anything for discomfort this evening, then you're more than welcome to use some Tylenol, but it's always good to steer clear of any NSAIDs such as Motrin, Aleve, Advil. Sometimes those things can increase your risk of bleeding in the areas and increase your risk of bruising. Here at our clinic, we do use a topical cream called Arnica that can help with some of the swelling and bruising. We'll apply that today before she leaves to go home and send her home with an ice pack as well.